I'm here with Annette Graham. Annette, please tell me a little bit about yourself and your background, I guess, in public health.
Okay. Well, I've worked in public health probably most of my career. I have a degree in social work and gerontology, and I'm also a clinical social worker. I'm currently the executive director for the Central Plains Area Agency on Aging and the Sedgwick County Department on Aging. We provide services for older adults. We provide services for individuals with physical disabilities. We also provide transportation and housing services. So we operate across the arena of services that really contribute to the health and the public health in our community.
Awesome. So tell me a little bit, what drew you to public health in the first place?
Well, I always had a desire to help people and to help the people that live in our community. So I've worked in a number of different venues across different types of services. The first was in protective services and in-home and community services. So I really saw the value of a government assistance and nonprofit assistance to help people live the best healthy lives they could, and to help them. Working in the field of aging always was to help them stay in the community as long as possible. So it really became, at a macro level, more that population health focus.
Nice, very nice. I guess kind of on top of what you've already talked about, what types of projects have you coordinated / helped with over this previous year?
So what kind of projects? We've been working in the area of transportation to try to increase transportation access to individuals both within the city but also in the area surrounding the city. So we worked with some other funders, with the City of Wichita and with the Kansas Department of Transportation and some other partners to really focus on increasing the coordination of services and to work across programs to increase the accessibility and availability of transportation for the individuals that are transit dependent. So we've done a lot of work with that and are excited about some of the opportunities coming along with that. We've worked with some of our local providers to make some revisions in some of our services that serve seniors. So we've implemented some programs that will start taking effect this year, starting in October, to make some more choice availability for senior nutrition programs.
Okay.
And we've also increased accessibility of nutrition services, home delivered meals in those regions of our service area that are outside the traditional home delivery routes, so that more people will have accessibility to the home delivered for those more in the rural areas. We've also done some work around diabetes prevention, so we've started a new diabetes prevention program. So we're working on expanding that, becoming a certified provider, and targeting for those individuals that are at risk of diabetes, to really help them, provide them some tools that they can utilize to hopefully delay or prevent the onset of diabetes and really improve their health. And then finally, a new program we've implemented is called Medication Reconciliation. It's a evidence-based program where we work with individuals, seniors in the community, to really do an in-depth review of their medications and their use of vitamins and supplements to really help identify if there's issues and to address those issues to improve their health.
Nice.
Through that.
That's all really amazing. That's some stuff I've never thought of before. So great services.
Thank you.
My next question is, if you had to pick one topic to shed more light on / fix in public health, what might it be?
Well, an area we've been looking at really is related to the social determinants of health. So when we look at the population that are at risk of nursing home placement or overutilization of hospital care, medical care, emergency room care, we see that there's a lot of issues related to the social determinants. So I think in our society focused a lot on improving that medical care, but so a big part of medical care and outcome for an individual is related to social determinants. So looking at that broader picture of social determinants, and that would include some of the programs we've already discussed, like transportation, nutrition, medication reconciliation, medication usage. It also includes things such as helping people manage in their day-to-day lives, home modification, accessibility, functioning in the home, kind of care assessment of what that individual needs, and help them to address those issues that are important to them that will improve their health outcome through improvement of those social determinants.
So it kind of ties together.
Yes, definitely.
I like that. My next question is, what challenges have you come across in public health? I don't know how to word it.
Well, probably one that everybody notices is funding. So that's a challenge because the funds are decreasing and they're really hard to access. I think another challenge, however, is just kind of working across the systems, kind of at the macro level, working with other partners. So when we talk about social determinants, coordinating and working with health providers, medical providers, and other providers to take a more holistic perspective. So I think that's a challenge in figuring out how to do that, but also how to educate the community and provider network about those other pieces in health outcome and in population health, to begin to figure out how do we work together and how do we fund across systems to fund those, a different kind of model of service delivery, a more integrated service delivery system that really can address some of those key components that in the end will improve the health outcomes and the well-being and the longevity of community tenure for the population, if we can help address those pieces together.
Yes, that's great. Next, I would like to ask, so tracing back a little bit, you told us what drew you to career in public health, but how did you start your career in public health?
Well, I started in aging services. That's always been my primary focus, was geriatric types of services. So I really started in my college years cleaning. I worked for the state and I was a homemaker, and I went into seniors' homes and helped them with their keeping their houses clean, making their meals, helping access other services. So it really was at that really direct service level, and I really learned then a lot about community needs and the issues that people face at that ground level. So learning from that, and then I worked for the state for many, many years and came up and worked through and learned about funding, but I learned about other social programs that focus on seniors, but also individuals with disabilities and children. So all of those services the state provides, and learned about that and really saw the value in working with community and working on that greater good of public health.
That's amazing. I like how you started as a homemaker, helping them, being one-on-one, the personal care. That's awesome. My last question for you is, what is the best or your most favorite part of your job?
Favorite part of my job is when it all comes together and we get to really see the outcomes and the impact, that we see programs and services that really do what they're intended to do, so that the people that we serve, the population we're focused on, gets the services they need, and those outcomes are successful, and that serves the people, it serves the community, but it also reinforces to the funders and the administrators of programs that these dollars are well spent and that there is ultimate value in what we do.
Yes, that's amazing. Again, I'm meeting with Annette Graham. Annette, thank you so much for meeting with us today.
Thank you.